in utero development is also part of the affect. So how the baby develops in utero is a big factor. Also included in that is the way they're positioned in the uterus. So abnormal positioning in the uterus can create stress as the baby tries to go from the uterus through the birth canal and exits the birth canal. Very often, if there are assisted delivery processes that need to be done, forceps delivery, vacuum delivery, or on the far extreme, a C-section, that affects the baby's overall neurological and functional and structural processing. One of the things that causes the most damage in a baby's spine is traction of nerves, not compression of nerves. So as the baby leaves the uterus, which is about 10 millimeters of mercury, and goes through the transition phase, that amount of pressure increases to 100 millimeters of mercury. So if the baby is at a position, is torqued within that birth canal, that you're thinking of a tenfold increase in pressure against the head, the cranium, and the spine. So if we look at a baby's cranium, we can see these soft spots and fontanelles. The whole idea of the cranium designed in this way is to allow the cranium to collapse as the baby comes down the birth canal, and then within 7 to 10 days, as they exit birth canal, the cranium is supposed to expand into a normal position. If the head is twisted or torqued, it also puts a lot of stress right at the base of the brainstem, the upper cervical spine. This is the most vulnerable area in the infant spine. So there's too much torsion or stress it can stress the dermomeningeal system, it can traction the nerves. And once that process occurs, that creates a compensatory pattern. If not corrected, that compensatory pattern can be maintained for the rest of the baby's life and affect neurological development, processing issues, balance, anything that occurs from that area of the brainstem, which is, of course, the primary focal area for developmental milestones, coordination, and balance in the infant.